In this video, we are going to learn about the origin, insertion, muscle action and nerve supply for the muscles of gluteal region. There are total 10 muscles considered in the gluteal region, but if we consider the obturator externus to be the muscle of the medial compartment, then we can say that there are 9 muscles in the gluteal region. The first muscle to be indicated is piriformis. It originates from the anterior surface of sacrum, sacrotuberous ligament, and also from the upper margin of greater sciatic notch, and it is inserted on the apex of greater trochanter of femur. The next muscle to be indicated is gluteus minimus. It originates from the gluteal surface of ilium between anterior and inferior gluteal lines and is inserted on the anterior surface of greater trochanter of femur. The next muscle is obturator internus. It originates from the pelvic surface of obturator membrane. Superior to obturator internus is superior gemellus muscle. It originates from the ischial spine. Inferior to obturator internus is inferior gemellus muscle, which originates from ischial tuberosity. All of these 3 muscles, including the obturator internus and 2 gemelli, are inserted on the medial surface of greater trochanter of femur. The last muscle to be indicated in this diagram is quadratus femoris. It originates from the ischial tuberosity of ischium and is inserted on the quadrate tubercle of femur. In the next diagram, we will see the origin and insertions of 3 superficial muscles. The first to be indicated is gluteus maximus. It originates from the area behind the posterior gluteal line of ilium, sacrum, coccyx and sacrotuberous ligament and is inserted on the iliotibial tract and gluteal tuberosity. The second muscle in this diagram is gluteus medius. It originates from the area between the anterior and posterior gluteal lines of ilium and is inserted on the lateral surface of greater trochanter. The last muscle to be indicated is tensor fascia lata. It originates from the anterior superior iliac spine, iliac crust and is inserted on the iliotibial tract. Now let's discuss the nerve supply of these muscles. Gluteus maximus is supplied by the inferior gluteal nerve. Gluteus medius, gluteus minimus and tensor fascia lata are supplied by the superior gluteal nerve. Obturator internus and superior gemellus have a common nerve supply and are supplied by nerve to obturator internus. Likewise, quadratus femoris and inferior gemellus have a common nerve supply and are supplied by nerve to quadratus femoris. The last muscle is piriformis, which is supplied directly by the ventral rami of S1 and S2. Now let's take a look at the actions performed by these muscles. The gluteus maximus is the chief extensor of thigh at hip joint. This action is very important in rising from a sitting position. It is also essential for maintaining the erect posture and is a lateral rotator of thigh, abductor of thigh. Along with tensor fascia lata, also stabilizes the knee through the iliotibial tract. The gluteus medius and gluteus minimus are the powerful abductors and medial rotators of thigh and they maintain the balance when the opposite foot is off the ground. The tensor fascia lata is also an abductor and medial rotator of thigh and it also prevents the external rotation of thigh at hip joint. The remaining 6 muscles of gluteal region, including the piriformis, superior gemellus, inferior gemellus, quadratus femoris, obturator internus and obturator externus have a common function that they laterally rotate the thigh at hip joint.